All right, so moving on to the ankle, we are going to be looking at some of our more common ligamental tests. So we'll start with tests that I would give for a potential inversion ankle sprain. So the first one that I would think of is the ligament that's most commonly injured, which is going to be our ATF ligament, anterior talofibular. So to test that, we're going to start with the anterior drawer test. So to do that, I'm going to stabilize just above the joint line here. I'm going to use my other hand to grip the calcaneus, and I'm going to kind of use my thumb here to palpate for that ATF. I'm going to give slight dorsiflexion using my forearm, and then just stabilizing with my left hand. I'm lifting from the calcaneus, feeling the tension in the ATF here. Positive test would be as if this replicates the patient's symptoms, which would be positive for an ATF tear. Second would be our posterior drawer test. So again, I'm kind of stabilizing just above the joint line. This time I'm grabbing in front and I am pushing downwards using the thumb of my left hand to kind of palpate the posterior talofibular ligament. And a positive test would be, again, if that replicates any symptoms. Third, and the last one we'll do right now for our inversion ankle sprain is going to be the calcaneofibular ligament. And to do that, we'll do a varus stress test. So for that, I'm going to, again, just kind of use this hand to palpate and stabilize. And I'm going to grip under the calcaneus, put them in a slight dorsiflexion, and give a slight varus force, just feeling the tension here, making sure that everything feels okay, and again, making sure that there is no replication of symptoms. For the deltoid ligament, which we'd see a little more commonly with an eversion ankle sprain, I'm going to be doing something very similar. It's another Taylor tilt test. So again, I'm putting slightly into dorsiflexion, grabbing at the calcaneus, and giving a valgus force, and then just palpating the deltoid ligament here on the medial side, just below the medial malleolus. Again, a positive test would be if I feel anything strange or if this is a replication of the patient's symptoms.